You go on the path, but the path is rough. But don't turn back. Have yourself motivated fully and just think that whatever happens, happens for the best, and take those learning lessons and just move ahead and change your strategies and your vision.
You need to learn to take the decisions and show how the decisions are correct and you were right in taking those decisions.
In a city like Mumbai, healthcare is the backbone of a thriving, diverse population. It's a fast-paced, ever-evolving sector that demands strong leadership, innovative solutions, and a commitment to care. Today, more women are stepping into the role of leaders, guiding some of the city's most prominent hospitals. On International Women's Day, we turn the spotlight on the women leading these medical institutions, the leaders who are not only managing the day-to-day operations, but also shaping the future of healthcare in Mumbai. These women are making decisions that affect thousands of lives, driving positive change, and setting new standards in patient care. Through their unique journeys, they have built organizations that reflect their vision of healthcare, compassionate, efficient, and forward-thinking. Let's hear out these leaders about their experiences that have shaped their careers, the challenges they face, and their aspirations for the future of healthcare in India.
Hi, I'm Dr. Minnie Bodhanwala, the CEO of the Wadia Group of Hospitals. I actually am a healthcare entrepreneur. I started my journey around 37 years back in this industry, and it's always been a challenging journey. Basically, by profession, I'm a dental surgeon, and from dental surgeon, I moved on into various aspects of healthcare, updated myself with the required knowledge, and moved on to where I am today. When I started this healthcare journey, there were hardly any women, or maybe no women in this industry. And I think after around 20 years of my dental practice, I thought, I had an administrative skill which I needed to, upgrade myself with the required knowledge and use it and help a lot of people. One of the accomplishments I'm proud of, that yes, in the healthcare industry, first of all, has given space to women leaders to grow now. And the second thing, which rather the most important thing and the most closest thing to my heart, are the two hospitals in which I am today, Baijarbai Wadia Hospital for Children and Nauroji Wadia Maternity Hospital, which were on the verge of closure in 2012, and the challenge to get them up to an international standard where they are in the next 12 years as we see today. I think the lead in womanship is transforming the healthcare because the main thing is women can multitask. I think the government is also working on certain policies, how to empower women. Implementation of those policies would have to be monitored to see that yes, women who are really capable of these positions, achieve them. I have a message for all those who are aspiring in, not only in the healthcare industry, but in any business, I would say, you go on the path, but the path is rough. But don't turn back. Have yourself motivated fully and just think that whatever happens, happens for the best, and take those learning lessons and just move ahead and change your strategies and your vision and your goal.
I'm Dr. Tarang. I am the CEO at Sir H.N. Reliance Foundation Hospital, and I also am the Group CEO for the other foundation healthcare initiatives. I'm a mother of two. My daughter is also doing medicine, and my son is 17-year-old and wife of a banker who is in investment banking for almost more than 30 years now, and a person who loves the family as much as I love my work. leadership in healthcare has always been perceived as a male dominated area. Um, if it is a job for a front facing patient interaction, or if it's a position in HR, or if it's a position in quality or community interact, for the longest time women were considered the best. But when it came to finance, strategic decisions, running business, it was always the men who were supposed to rule the roost. So obviously when I also started my career, I experienced it. Not only it is something which we feel is in India, but I think it is at global level. And there were times where I was supposed to prove myself that yes, women can take decisions. And one of my mentors, I always remember him. Yes, it's a him. I always remember him because he always says that Dr. Tarang, nobody will ask you or give you decisions to take. You need to learn to take the decisions and show how the decisions are correct and you were right in taking those decisions. Some of the key things that I personally feel that I have done it well, and I feel very accomplished and happy at the end of it is one, as I said earlier, was working during the time of crisis, working during COVID, building in resilience in the system. The other is that I have worked hard, and I somehow feel that I have transformed the way people look at healthcare institutions. These are not only places where one has a good infrastructure, one has a good technology, but it is also the person who leads these structures and how they perceive patient experience and patient care. So I have worked towards shifting the thought process of people right from bottom to the top. It is not something that should just end with a woman giving birth to children. It is something which should be a priority for all women throughout their life. This will help a lot of women to get earlier help from menstrual issues, from polycystic ovarian syndrome or PCOS as we call it, or from postpartum depression, postpartum hemorrhages, and many other issues that women usually face during their entire lifetime, which constitutes the reproductive health. So I think these are some of the key areas where women's health should be focused on.
It is not easy to lead in a field where lives are at stake, where every decision matters and where stakes are ever so high. But for these women, it's more than a job, it's a mission, a calling. And with every challenge they face, they continue to pave the way for those who will follow.